How's it going, everybody? My name is Andre.
And my name is Hansah.
And we're coming to you from Breathe AJC Foundation. And if you don't know what our foundation is all about, we're just here to spread awareness through the asthma education to the youth, adults, and families living in the Metro Detroit area. And we got a special topic to talk about today. What is that?
So today we're going to be talking about exercise-induced asthma. We're going to talk to you today about the symptoms, causes, what are some of the best sports to play, what are some sports you should avoid, how to manage your exercise-induced asthma, as well as what are some of the best medication options out there if you have exercise-induced asthma. So first, what is exercise-induced asthma?
What is exercise-induced asthma? And as far as we know, everybody needs to exercise. Everybody. It just builds a healthy lifestyle, healthy body. You're just being healthy all around. I just advise everybody to exercise. Even people with asthma. But people with asthma that exercise, they have episodes that happen when they exercise. And what is that called? It's called EIB. And what is EIB? EIB stands for Exercise Bronchoconstriction. It's a little tongue twister, but that's what it's called. And what the bronchoconstriction is, just obstructs the airflow when you're exercising. It just narrows down your airway. You're trying to breathe when you exercise, and it just narrows down your airways. It makes it hard for you to breathe. As far as we know, about like 90% of people with asthma will experience this, especially teenagers and young adults. They're the most common. And when you do have these episodes, it will be similar to an asthma attack. But what are some of the symptoms that happen when you have the EIB?
Yeah, so some of the symptoms of exercise-induced asthma can come during or soon after you are exercising. Sometimes these symptoms can last 60 minutes or longer if you don't treat them. So you want to be definitely intentional around what are some of the symptoms, and I'll list them now. So coughing, wheezing, shortness of breath, tightness of the chest or pain, fatigue during exercise. You'll experience poor athletic performance just generally, and then with smaller children, you'll notice that they avoid activity altogether. So of those symptoms, coughing is the most common symptom of exercise-induced asthma and may be your only symptom. Symptoms usually don't occur immediately at the start of exercise, but they begin during exercise and will usually worsen about 5 to 10 minutes after you have stopped exercising. Symptoms most likely resolve 20 to 30 minutes in. It can range from mild to severe, but one thing you should also be mindful of is that some people will experience a second wave of symptoms, which is called late phase. And that can be 4 to 12 hours after you've stopped exercising. Late phase symptoms are usually less severe, but can take up to 24 hours to resolve. So let's talk about what are some of the causes of exercise-induced asthma.
What are some of the causes? When you exercise, you're breathing faster and deeper, due to the increased oxygen that your body demands. You're usually inhaling through your mouth, which causes the air to be drier and cooler rather when you're breathing through your nose. And dry and cold air, that's pretty much the main trigger for narrowing down your airway. Like I said, what that is called, it's called bronchoconstriction. It's narrow down your airway. So it's hard for you to breathe when you're exercising and when you have asthma. The exercises that exposes you to cold and dry air are some sports. Some sports are like hockey, skiing, ice skating, snowboarding. Those are type of sports that exposes you to cold and dry air. And I'm not saying that you can't play all sports when you have the EIB, when you're having asthma. Some sports you can go in warm climate sports, which doesn't trigger the EIB. Those sports include volleyball, baseball, gymnastics, walking, leisure biking. You can swim, or just any sports that involves you to being in a warmer environment, pretty much. Like I said, that cold and dry air, that causes the EIB to become active. Besides sports, there are other triggers that will trigger off the EIB. The other triggers, they can be, high pollution levels, high pollen count, exposure to other irritants, such as smoke and strong fumes.
Mm-hmm.
Like you're in an industrial building or you're in your household, you can have some
Mm-hmm.
strong fumes that might just make your EIB become active.
Mm-hmm.
Or if you had a recent cold or a recent asthma attack,
Mm-hmm.
that might flare up your EIB. And like I said before, you can play sports or
Mm-hmm.
you could do some type of exercise that you have to be in a warm environment to do, but I would steer away from the cold environment
Yep.
of sports when you're playing.
Mm-hmm.
But there is ways that you can manage the EIB.
Yep. So, obviously, with a proper management protocol, you can still enjoy all your activities and exercises to the full potential, but you must take some necessary steps. So, an example of preventing that cold and dry air from entering your lungs, which could be a trigger for exercise induced asthma, is covering your mouth, wearing scarves, wearing a mask, or just avoiding, again, those cold and dry climates. Make sure you take your medication prior to exercising. If you have a short-term or a long-term medication system, make sure you follow those instructions, your doctor's instructions in terms of how to administer that before you exercise. Make sure you do a proper warm-up. Even if you're not an asthmatic or prone to EIB, you should do a proper warm-up, but especially if you're prone to exercise-induced asthma episodes, you should do a 10-minute warm-up prior to any vigorous exercises or activities. And then as you're exercising, make sure you're monitoring your symptoms and watching your respiratory status before, during, and after exercise so that you can proactively manage your exercise-induced asthma. This goes for children when they're at school or when they're playing their sports. Make sure that you have those conversations with their coaches and their teachers to ensure that they're following the necessary protocols to manage and treat their exercise-induced asthma. It goes without saying that you need to make sure you consult with your healthcare professionals and your doctors before you begin any exercise program. Take your time, ease into it, and follow those effective steps towards managing your EIB. I want to go over a couple treatment options when it comes to medication for preventing or managing your exercise-induced asthma. There are the short-acting beta bronchodilators, in which you should take that prior to exercise, at least 10 to 15 minutes before you get into your activity. This usually helps prevent symptoms up to 4 hours. This also can help reverse or treat symptoms should they occur of exercise-induced asthma. Then you have your long-acting bronchodilators. Those should be taken 30 to 60 minutes before you engage in your exercise, and only take that within a 12-hour period. That helps to manage your symptoms of exercise-induced asthma for 10 to 12 hours. This is used mostly on a preventative measure and does not offer quick relief. So again, you can use your long-acting bronchodilator, but make sure you have a short-term medication treatment on hand, such as your inhaler or your short-term acting bronchodilators, such if you were to have symptoms regardless. Again, I want to make sure I reiterate that you talk to your doctor, go through your symptoms, go through the frequency and intensity of those symptoms so that you can be on the proper medication protocol for managing your exercise-induced asthma. So I think we covered everything today. What do you think?
I think we did as well.
Yeah.
I just want to throw out there, the reason we're telling you this, because we do exercise. And I am the main person that has asthma. I do have asthma myself. So I do know what a EIB is. I have to take precaution. It's a serious thing. That's why we're doing this as of right now. We have this foundation together. We just want to make people aware that asthma is really nothing to play with. If you do have an inhaler or you have any breathing treatments or anything that helps you along when you're exercising, take those before. Maybe have a couple puffs of your inhaler before you do your activity, or you want to take a treatment. If that helps you out, if you have a seriousness with your asthma, if it's real serious, take a treatment before you exercise. I have to. I have to take a couple puffs of my inhaler before I do my exercise, and it helps me out tremendously. But like I said, everyone needs to exercise. Like I say, even with people with asthma, it just builds a strong, healthy body, and that's one of your best defenses against this disease. Please, if that doesn't work, if your inhaler doesn't work, your treatment doesn't work, call 911. That would be your best option if those two items do not work. Call 911.
Yep.
It's better to be here than being somewhere else. And that's why we're here to educate you guys and just give you pointers on what to do if that happens. But with that said, this is a important topic that we wanted to put out there. This is our new YouTube channel. We do have 2 other videos out there. Our CEO, Leonis Quinn, she has 2 videos out there as of right now telling you about what asthma is and what triggers them. So we want you to go check those out. Make sure you hit that subscribe button, hit the like button, pass this around, send the link to all your friends and family, because we want to just build awareness and tell everybody what our foundation is all about and what our mission is.
Yep, and you can also find us at Breathe AJC Foundation.com if you want to go and read up more on our foundation or make a donation. So Breathe AJC Foundation.com.
All right, people, that's it for today. We'll be back with another video.
All right, have a good one.
All right, thanks.
Bye.
Bye.